Have you ever felt a persistent itch that just won't go away, no matter what lotions or creams you try? As an 88-year-old oncologist with over 50 years of experience, I'm Dr. Charles Chuck Miller, and I'm here to share a critical truth. That itch could be more than just a skin issue. It might be an early warning sign of cancer. In this video, I'll reveal the 6 dangerous areas of your body where itching could signal serious health risks, especially for those over 60, and guide you through simple self-diagnosis tests you can do at home. You need to watch until the end because this information could save your life or the life of someone you love by helping you catch these subtle signs before it's too late. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. The lower leg. A potential sign of lymphoma. The lower leg, particularly the front portion, the shin area, can sometimes serve as an unexpected window into your body's internal health. Persistent, unexplained itching in this region may be more than just a skin irritation. It could be an early warning sign of lymphoma, a type of cancer that affects the lymphatic system. The lymphatic system, a critical component of the body's immune network, includes lymph nodes, vessels, and organs like the spleen. When lymphoma develops, the abnormal growth of lymphocytes, a type of white blood cell, can lead to inflammation. This inflammation releases chemical mediators, such as cytokines, that irritate peripheral nerves in the skin, particularly in the lower legs. The result is a deep, persistent itch that feels distinctly different from typical skin-related itching, such as that caused by dryness or eczema. To illustrate this, let me share the story of Mr. Johnson, a 75-year-old retired schoolteacher I encountered last winter during a particularly harsh cold spell. For 3 months, Mr. Johnson had been plagued by relentless itching on the front of both lower legs. What began as a mild, occasional irritation progressed into a nightly ordeal. By 3 a.m., the itching would intensify to such an extent that it disrupted his sleep, leaving him frustrated and exhausted. He described the sensation as a deep, burning itch that seemed to originate beneath the skin's surface. Scratching provided no relief. In fact, it often made the sensation worse, which puzzled him. Initially, Mr. Johnson attributed the problem to poor blood circulation, a common issue in older adults. He tried self-massage techniques, applied warm compresses, and even invested in high-quality compression socks. His wife, deeply concerned, purchased an array of expensive moisturizing lotions and anti-itch creams, hoping they would alleviate his discomfort. Despite their efforts, nothing worked, and the itching persisted unabated. How to check for lymphoma-related itching at home. If you're experiencing persistent itching in your lower legs, there are steps you can take at home to differentiate between common skin issues and something more serious, like lymphoma. Start by applying a high-quality moisturizing lotion, preferably fragrance-free, and an over-the-counter anti-itch cream, such as one containing hydrocortisone, 2 to 3 times daily for at least 1 week. For most skin-related conditions, such as dry skin or mild dermatitis, this regimen should provide noticeable relief. However, itching caused by lymphoma is unlikely to respond to these topical treatments. The irritation may worsen, as the underlying issue stems from systemic inflammation rather than a surface-level problem. Another critical clue is the timing of the itch. Lymphoma-related itching often intensifies at night, particularly when you're lying down. This is because the lymphatic system's activity shifts during rest, and the body's circadian rhythm may influence the release of inflammatory substances. When you lie down, blood flow and lymphatic drainage slow, allowing these irritants to accumulate and stimulate nerves more intensely. Unlike typical skin itching, which may be accompanied by visible redness, flaking, or irritation, lymphoma-related itching often occurs without any obvious skin changes. If you've been dealing with unexplained lower leg itching for more than 3 weeks, especially if topical treatments have failed to provide relief, it's time to seek medical attention. Consult a hematologist or oncologist specializing in blood disorders for a thorough evaluation, which may include blood tests, imaging studies, or a lymph node biopsy to check for lymphoma. Fortunately, Mr. Johnson's story has a positive outcome. His persistent symptoms prompted him to seek medical advice, leading to an early diagnosis of lymphoma. With timely treatment, which included chemotherapy and immunotherapy, he achieved a full recovery. Early detection of lymphoma significantly improves outcomes, with survival rates for certain types, such as Hodgkin lymphoma, reaching up to 90% when caught in the initial stages. Have you noticed persistent, unexplained itching in your lower legs recently? If so, don't dismiss it. Monitor the symptoms closely and consider seeking professional advice. 2. The middle of the back, a warning sign of pancreatic issues, continued. First, Ms. Williams assumed the itch was due to an external cause, such as an allergic reaction to her bedding. She replaced her mattress with a hypoallergenic one, swapped out her pillows and blankets, and even hired a professional cleaning service to eliminate dust mites from her home. When these measures failed, she and her family went to great lengths, discarding rugs and replacing furniture, including their living room couches, to pinpoint the cause. "Doctor," she told me during her visit, "we practically turned our house upside down, but that one spot on my back still itches relentlessly." Frustrated, she consulted a dermatologist, who conducted allergy tests and prescribed a series of topical treatments, including steroid creams and antihistamine lotions. Despite her diligence in applying these remedies, the itch persisted unchanged. What made Ms. Williams' case particularly striking was the pattern of her symptoms. The itching was tolerable during the day but would intensify significantly after dinner, typically around 7 o'clock or 8 p.m. She initially suspected a food allergy, so she meticulously altered her diet, avoiding common triggers like dairy, gluten, and spicy foods. Yet, regardless of what she ate, the itching returned like clockwork each evening. This consistent timing was a critical clue, as pancreatic issues often manifest more prominently after meals, when the organ is actively producing digestive enzymes. How to check for pancreas-related itching at home. If you're experiencing persistent itching in the middle of your back, there are steps you can take at home to assess whether it might be related to a pancreatic issue. Begin by gently pressing on the itchy spot with your fingertip. If the itch is connected to the pancreas, you may feel a subtle heaviness, tenderness, or discomfort in the area, distinct from the sensation of a typical skin itch. This is because the irritation originates from internal nerve pathways rather than the skin's surface. Next, pay close attention to your digestive health. The pancreas produces enzymes essential for breaking down fats, proteins, and carbohydrates. If you notice symptoms like indigestion, bloating, or discomfort after eating greasy or heavy meals, this could be a red flag. Other warning signs include unexplained weight loss, changes in stool, such as greasy or foul-smelling stools, or mild abdominal discomfort. Unlike muscle aches or skin irritations, pancreas-related itching does not respond to typical treatments like pain patches, massages, or over-the-counter creams. Many people, like Ms. Williams, initially mistake the sensation for a musculoskeletal issue or a minor skin problem, delaying proper diagnosis. If you've been dealing with a persistent itchy spot on your mid-back for more than a few weeks, especially if it worsens after meals or is accompanied by digestive issues, don't ignore it. Schedule an appointment with a gastroenterologist or oncologist for a thorough evaluation, which may include blood tests to check for elevated pancreatic enzymes or tumor markers, imaging studies like a CT scan, or an endoscopic ultrasound to assess the pancreas. Ms. Williams was fortunate to seek medical attention when she did. After further testing, she was diagnosed with early-stage pancreatic cancer. Thanks to prompt intervention, including surgery and targeted therapy, her prognosis improved significantly. Pancreatic cancer is notoriously difficult to detect early, but recognizing subtle symptoms like mid-back itching can make a life-saving difference. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 3. The scalp, a potential indicator of leukemia. The scalp, particularly the areas behind the ears and along the neck, is another region where the body may signal an underlying health issue, such as leukemia. Leukemia, a cancer of the blood and bone marrow, is characterized by an overproduction of abnormal white blood cells. These cells release inflammatory substances that can stimulate the tiny nerves in the scalp, leading to persistent itching. Unlike typical scalp irritation caused by dandruff, psoriasis, or harsh hair products, leukemia-related itching is often unaccompanied by visible skin changes like redness or flaking. This makes it particularly perplexing for those experiencing it, as the sensation seems to have no obvious cause. One of my most memorable patients, Mr. Harris, a 73-year-old retired accountant, exemplified this condition. A meticulous individual, Mr. Harris kept a detailed journal of his symptoms, which he presented to me during his visit. For 3 months, he had been troubled by an intense itch on his scalp, particularly behind his ears and at the base of his neck. "Doctor," he said, "I've recorded every detail, when the itching starts, how long it lasts, and what I've tried to stop it." His journal revealed a clear pattern. The itching was minimal during the day but became unbearable at night, especially after he lay down to sleep. Initially, he suspected his shampoo was to blame and switched to a gentle, fragrance-free formula. He also stopped using conditioner, tried washing his hair with a mild soap bar, and even reduced the frequency of washing to every other day. Despite these efforts, the itching persisted, and he noticed no dandruff, redness, or other visible signs of irritation. The worst of it, he noted, was the constant urge to scratch behind his ears, which provided no relief and sometimes left his skin raw. How to check for leukemia-related itching at home. If you're experiencing persistent scalp itching, you can perform a simple self-assessment to determine if it might be related to leukemia. Gently run your fingers over the itchy areas of your scalp. If the itch is associated with leukemia, you may notice that the affected spot feels slightly warmer than the surrounding areas due to localized inflammation caused by abnormal white blood cells. This warmth is subtle but distinct from the sensation of a typical scalp irritation. Pay close attention to the timing of the itch. Leukemia-related itching often worsens at night, particularly when lying down, due to changes in blood circulation and the distribution of inflammatory substances in the body. When you're horizontal, blood flow patterns shift, allowing these irritants to accumulate in certain areas, intensifying the itch. Additionally, look for other systemic symptoms that may accompany leukemia-related itching. These can include unexplained fatigue, frequent infections, slow healing cuts or bruises, bleeding gums, or small red spots, petechiae, on the skin. If you've been feeling unusually tired, noticing bruises you can't explain, or experiencing prolonged healing times for minor injuries, these could be warning signs that warrant further investigation. If scalp itching persists for more than 3 weeks, especially if it's unaffected by changes in hair care products or over-the-counter treatments like anti-dandruff shampoos or antihistamines, it's time to consult a hematologist or oncologist. Diagnostic tests, such as a complete blood count, CBC, to assess white blood cell levels, a bone marrow biopsy, or imaging studies, can help confirm or rule out leukemia. Mr. Harris's diligence in tracking his symptoms and seeking medical advice led to an early diagnosis of chronic lymphocytic leukemia, CLL. With appropriate treatment, including targeted therapies, he was able to manage his condition effectively and regain his quality of life. 4. Persistent itchiness near the chest. Let's now turn our attention to persistent itchiness around the chest area, which can sometimes be an early warning sign of serious conditions such as inflammatory breast cancer or, in rarer cases, male breast cancer. These conditions are distinct from more common breast cancers because they often do not present with palpable lumps, making them harder to detect without careful observation. The itchiness associated with these cancers is typically caused by the obstruction of lymph nodes or the infiltration of cancer cells into the skin, which triggers irritation. This irritation can cause the skin to take on a distinctive appearance, often described as resembling the texture of an orange peel, known medically as peau d'orange. This change in skin texture is frequently accompanied by persistent itchiness, redness, or swelling, which can be mistaken for less serious conditions like allergies or irritation from clothing. To illustrate this, let me share the story of Ms. Davis, a 69-year-old patient who visited my clinic a few months ago for a routine checkup. Ms. Davis is a meticulous individual who pays close attention to her health and is not one to dismiss unusual symptoms. She came to me with a concern about persistent itchiness in the area where her bra rested against her chest. "Doctor," she said, "I thought it was the bra causing the problem, so I switched to different materials. Cotton, silk, even bamboo. I tried wearing looser clothing and even went without a bra for a while, but the itching didn't stop." What stood out in her case was that the itchiness was confined to her right breast, with no similar symptoms on the left. This unilateral presentation raised a red flag, as asymmetry in symptoms can often indicate something more serious than a simple irritation. Here's how you can check for potential warning signs at home. Stand in front of a mirror and carefully examine both breasts for any differences. Look for changes in skin texture. Does one breast appear dimpled, puckered, or resemble the texture of an orange peel? Check for asymmetry in size, as one breast may appear slightly swollen or larger than the other. Pay attention to any changes in skin color, such as redness, darkening, or a mottled appearance. In Ms. Davis's case, her right breast not only itched but also showed subtle redness and a slight increase in size compared to the left. The location of the itchiness is also critical. Inflammatory breast cancer often begins around the nipple or the lower part of the breast, and the itchiness may be persistent and localized to one side rather than both. The progression of symptoms is another key factor. Initially, the itchiness may feel mild, like a simple irritation, but over time, the skin may thicken, lose its elasticity, or develop that characteristic orange peel texture. When you gently press on the affected area, you might notice that the skin feels less pliable or resilient than normal. These symptoms are not exclusive to women. Men can also develop breast cancer, though it's rare, accounting for approximately 1% of all breast cancer cases. Men over the age of 60 who experience persistent itchiness around the nipple or chest area should be particularly vigilant, as this could signal male breast cancer. Unlike other forms of breast cancer, inflammatory breast cancer tends to spread more aggressively, which underscores the importance of early detection. However, with prompt diagnosis and treatment, outcomes can be significantly improved. If you or someone you know is experiencing persistent itchiness around the chest, especially if it's accompanied by changes in skin texture, color, or size, don't dismiss it as a minor irritation. Schedule a checkup with a healthcare provider to rule out serious conditions. Does anyone here have concerns about ongoing itchiness in the chest area? If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 5. Persistent itchiness near the anus or reproductive organs. Next, let's discuss persistent itchiness in the anal or reproductive organ areas, which can sometimes be an early indicator of anal cancer or vulvar cancer. These cancers are less common but can be insidious because their symptoms are often mistaken for more benign conditions like hemorrhoids, infections, or skin irritations. The itchiness associated with these cancers typically arises when a tumor begins to compress surrounding tissues or irritate nearby nerves, leading to sensations of stinging, burning, or persistent itching. Unlike temporary irritation from inflammation or hemorrhoids, this itchiness tends to be more localized, intense, and resistant to standard treatments. To provide context, let me tell you about Mr. Ryan, a 76-year-old patient with a long history of hemorrhoids spanning over 30 years. When he first noticed itchiness around his anus, he assumed it was just another flare-up of his chronic condition. "Doctor," he told me, "I've dealt with hemorrhoids since I was in my 40s, so I know the drill. But this time, the itching felt different. With hemorrhoids, I usually feel pain when I sit or use the restroom, but this was a constant itch, even when I was at rest." Mr. Ryan tried his usual remedies, over-the-counter hemorrhoid creams, warm sitz baths 3 times a day, and even consulted the surgeon who had previously performed his hemorrhoid surgery. To his surprise, the surgeon told him everything appeared normal. Yet the itchiness persisted, and it was particularly bothersome at night, making it difficult for him to sleep. Here's how you can differentiate between benign irritation and something more concerning. Start by noting the specific location and nature of the itchiness. Hemorrhoids or minor inflammations typically cause diffuse discomfort or irritation that improves with treatment. In contrast, cancerous itchiness is often concentrated in a specific spot and may feel like a prickling or needle-like sensation. Many patients describe it as distinct from the broader discomfort of hemorrhoids. Additionally, the pattern of the itchiness is important. With benign conditions, the discomfort often improves with time or treatment, but with cancerous itchiness, the symptoms tend to worsen, particularly at night, as Mr. Ryan experienced. Pay close attention to any accompanying symptoms. For example, with anal cancer, you might notice bleeding during bowel movements, changes in stool consistency, such as narrower stools, or a feeling of incomplete evacuation. For vulvar cancer, symptoms might include discomfort during urination, changes in the color or smell of vaginal discharge, or the appearance of unusual growths or sores. Another critical clue is the response to treatment. Benign conditions like hemorrhoids or minor infections often improve with creams, sitz baths, or antibiotics. In contrast, itchiness caused by cancer typically does not respond to these treatments and may even intensify over time. Embarrassment can be a significant barrier to seeking care for symptoms in these sensitive areas, but it's crucial not to delay. Like Mr. Ryan, many people dismiss persistent symptoms because they attribute them to pre-existing conditions. Early detection is vital, as anal and vulvar cancers can be treated effectively if caught in their early stages. If you're experiencing persistent itchiness or discomfort in the anal or reproductive areas, especially if it's accompanied by other unusual symptoms, make an appointment with a healthcare provider as soon as possible. Is anyone here noticing ongoing discomfort in these areas that hasn't responded to standard treatments? 6. Itchiness in the hands and feet, a hidden warning sign. Let's now explore the significance of itchiness in the hands and feet, particularly when it's confined to the palms and soles. This specific symptom can serve as a critical red flag for internal cancers, and it's one that's often overlooked or misdiagnosed. The mechanism behind this is fascinating yet concerning. Cancer cells, as they grow, can release toxins or inflammatory substances into the bloodstream. These substances can irritate the peripheral nerves, particularly in the extremities like the fingertips, palms, and soles, leading to persistent itching. This symptom typically emerges when the cancer has progressed to a certain stage, making it a vital clue to catch early. To illustrate, let me share the story of Mr. Allen, a 70-year-old retired teacher who came to my attention with a perplexing case. For months, he experienced relentless itching confined to the palms of his hands. Initially, he dismissed it as housewife's eczema, a common skin condition often linked to frequent hand washing or exposure to irritants. He visited a dermatologist, who prescribed a standard treatment regimen, including topical steroids and emollients. Mr. Allen was meticulous in managing his condition. He wore gloves while doing household chores, switched to a hypoallergenic, fragrance-free soap, and applied a thick moisturizing lotion 5 to 6 times daily. He even took to wearing soft cotton gloves at night to prevent scratching in his sleep. "Doctor," he said with frustration, "I've done everything right. I've cut down hand washing to once or twice a day, using only lukewarm water, and I avoid harsh chemicals. So why is this itch still tormenting me?" What puzzled both Mr. Allen and his dermatologist was that the itch was strictly limited to his palms. The backs of his hands were completely unaffected, and the deep lines in his palms were especially bothersome. This specificity is a key clue. Itchiness linked to internal cancers often presents with unique characteristics. Here's how you can check for concerning signs at home. Examine skin color and texture. Closely inspect the palms of your hands and the soles of your feet under good lighting. In cases of cancer-related itchiness, you may notice a subtle yellowish tint to the skin, a condition known as jaundice, which can result from liver dysfunction or bile duct obstruction caused by certain cancers. Additionally, the lines on your palms or soles may appear deeper or more pronounced than usual, as inflammation or systemic changes affect the skin's appearance. Assess the itch pattern. Cancer-related itchiness tends to follow a distinct pattern. It often affects both hands and feet symmetrically, rather than just one side. It's also typically worse at night, a phenomenon known as nocturnal pruritus, which can disrupt sleep and cause significant distress. During the day, the itching may subside or feel less intense, which can falsely reassure patients that the issue is resolving. Test relief methods. With typical skin conditions like eczema or contact dermatitis, moisturizing creams, antihistamines, or soaking the hands and feet in cool water often provide relief. However, in cancer-related cases, these remedies offer little to no improvement. You might feel a fleeting cooling sensation from water or lotion, but the underlying itch persists, signaling that the issue lies deeper than the skin's surface. Consider associated symptoms. Itchiness linked to cancer rarely occurs in isolation. Look for accompanying signs such as unexplained weight loss, e.g., losing 3 to 5 kilograms in a month without changes in diet or exercise, persistent fatigue, low-grade fevers, or night sweats. These systemic symptoms can indicate an underlying malignancy and warrant immediate medical attention. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Mr. Allen's case was a textbook example. His palms not only itched but also appeared faintly yellowish, and the deep creases in his skin stood out more than usual. The itch was relentless at night, keeping him awake despite his best efforts to manage it. After weeks of unsuccessful treatments, he was referred for further testing, which revealed a pancreatic tumor, a diagnosis that might have been delayed if he hadn't sought a second opinion. It's all too common for people to dismiss itchiness in the hands and feet as a benign issue, attributing it to dry skin, allergies, diabetes, or poor circulation, especially in older adults. However, when the itching is confined to the fingertips, palms, or soles and persists despite standard treatments, it could point to abnormal peripheral nerve activity or a systemic condition like cancer. If you're over 60 and the itchiness has lasted more than 3 weeks, it's critical to schedule a comprehensive medical evaluation, including blood tests, imaging, or even a referral to an oncologist if necessary. Ask yourself, have you noticed any unusual sensations in your hands or feet lately? Don't ignore them. They could be your body's way of sounding an alarm. Self-diagnosis. 5 essential steps to catch it early. To empower you to take charge of your health, I'm sharing a 5-step self-diagnosis protocol to help identify whether your itchiness might signal something serious. These steps are straightforward, practical, and designed to help you detect potential issues early. Commit them to memory, and you'll be better equipped to act swiftly if needed. The 3-week test. Most skin irritations, such as allergies, contact dermatitis, or minor infections, resolve within 1 to 2 weeks with proper care. If your itchiness persists beyond 3 weeks, it's no longer a simple issue. To track this accurately, mark a calendar or set a reminder on your phone. Note the start date of the itchiness and monitor its duration. If it crosses the 3-week mark without improvement, consult a healthcare provider promptly for a thorough evaluation. The Lotion Response Test. For 1 week, apply a high-quality, fragrance-free moisturizing lotion or an over-the-counter anti-itch cream, such as hydrocortisone, 2 to 3 times daily to the affected areas. If the itchiness is due to a surface-level skin condition, you should notice significant improvement within a few days. However, if the itching remains unchanged or worsens, this suggests the problem may originate internally, such as from a systemic disease affecting the nerves or organs. In such cases, topical treatments are unlikely to address the root cause. Side symptoms check. Itchiness linked to cancer often comes with additional warning signs. Pay attention to your overall health. Have you lost 3 to 5 kilograms in a month without trying? Do you feel unusually fatigued, even after adequate rest? Are you experiencing low-grade fevers, night sweats, or a general sense of unwellness? These symptoms, when paired with persistent itchiness, could indicate an underlying malignancy, such as lymphoma, pancreatic cancer, or another systemic condition. If you notice any of these red flags, prioritize a medical checkup. Itch pattern analysis. Document the specifics of your itchiness to identify patterns that may point to a serious condition. Keep a journal and note when the itching is most intense, e.g., morning, afternoon, or night, which areas are affected, and whether the itch is consistent or moves to different spots. Cancer-related itchiness often worsens at night and remains confined to specific areas, such as the palms, soles, or a particular patch of skin. If the same spot itches persistently without shifting, this is a concerning sign that requires further investigation. Family history check. Your genetic background plays a significant role in your cancer risk. If you have a first-degree relative, parent, sibling, or child with a history of cancer, your risk may be 2 to 3 times higher, particularly for the same type of cancer. For example, if a parent had pancreatic or breast cancer, you should be especially vigilant about symptoms like itchiness. If you have a family history, schedule regular screenings and discuss your symptoms with your doctor, even if they seem minor. Early detection is your best defense. By systematically working through these 5 steps, you can gather critical information to share with your healthcare provider, enabling a more accurate diagnosis and timely intervention. Summary and actionable advice. Thank you for taking the time to explore this critical topic with me. Let's consolidate the key points and actionable steps to ensure you're equipped to monitor your health effectively. Recap of the 6 dangerous itchy spots. Lower legs. Persistent itching, especially worse at night and unresponsive to creams, may signal lymphoma. Consult a hematologist or oncologist for blood tests and imaging. Middle of the back. Itchiness in this hard-to-reach area, particularly when paired with digestive issues like bloating or nausea, could indicate early pancreatic cancer. Don't delay a checkup. Scalp or behind the ears. If changing shampoos or treatments doesn't help and the itching worsens at night, leukemia may be a possibility. Request a complete blood count, CBC, test. Chest. Itchy skin on the chest, especially with redness or swelling, could point to inflammatory breast cancer in women or male breast cancer. Men, don't dismiss this symptom. It's rare but possible. Anus or genital area. Persistent itching in these sensitive areas may suggest anal or vulvar cancer. Overcome any embarrassment and seek a specialist's evaluation promptly. Palms and soles. Itchiness confined to the palms and soles, especially with yellowish skin or deepened lines, may indicate internal cancers. Combine this with the self-diagnosis steps to assess the risk. Key takeaways from the self-diagnosis steps. 3-week test. If itchiness lasts beyond 3 weeks, it's time to see a doctor. Lotion test. No relief from moisturizers or anti-itch creams after a week suggests an internal issue. Side symptoms. Watch for weight loss, fatigue, fever, or night sweats alongside itchiness. Itch pattern. Note if the itching is worse at night or confined to one spot. Family history. A family history of cancer increases your risk, so stay proactive with screenings. Not every itch is a sign of cancer, but every cancer begins with subtle signals that are easy to overlook. As an 88-year-old physician with over 50 years of experience, I've witnessed countless patients whose lives were saved by paying attention to these small clues. Early detection is the cornerstone of successful cancer treatment, and it starts with listening to your body. I'm still practicing medicine because I believe passionately that these small signals can make a life-changing difference. What you can do tonight. Before bed, take a moment to examine your body. Check for itchy spots, note their location, intensity, and duration, and record when they started. Use a calendar or journal to track the timeline and any associated symptoms, like fatigue or weight loss. If your symptoms align with any of the warning signs discussed, don't hesitate. Schedule an appointment with your doctor. Be prepared to describe the onset, pattern, and any accompanying symptoms in detail to help your healthcare provider make an informed assessment. Your health is your most precious asset, far more valuable than wealth or status. Let this information be your first step towards safeguarding your well-being. In my next discussion, I'll dive into other common symptoms of aging, such as joint pain, digestive issues, and headaches, and what they might signal about your health. To stay informed, consider liking, subscribing, and enabling notifications for more health insights. Share this knowledge with your loved ones. It could save a life. Here's to a healthier, more vibrant future, starting with the steps you take today. Imagine where you could be a year from now, living with more energy, confidence, and peace of mind, all because you acted on the small signals your body is sending you now. Thank you for staying with me through this vital information about the warning signs of itching that could point to serious health concerns. I'm Dr. Charles Chuck Miller, and after over 50 years of treating patients, I've learned that listening to your body's small signals can truly save lives. So, what have you learned today? Maybe it's the importance of checking persistent itching in one of the 6 dangerous areas, or perhaps it's the self-diagnosis steps you can start using tonight. I'd love to hear from you. What's one thing you've learned from this video that you'll put into practice in your life? Please share it in the comments below. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel to stay updated on more life-saving health insights. Stay proactive, stay healthy, and I'll see you in the next video.